Hello, good afternoon. I'm Catherine Jeffcoat, and I know I had a lot interested in this topic today. We have feeding toddlers and preventing picky eating. So I know only a few are joining me live today. Thank you. And I know I'll be watching the replay later. So I'm recording this, and so if you're interested in watching it later, I will be sending this out. And so I like to do these little, I call them my lunchtime chats. And I know not everyone can get away, but I'm going to try to keep this under 30 minutes. So if you are on a lunch break at work um, or I know if you have a toddler at home right now, I know your time is short. So we're going to go through this presentation today, and I will save time at the end for questions, and you can just type those in the chat box, and I will pull those up if you have any. You can always email me directly too with questions, and I'm happy to answer those. So let's jump in. We're talking about feeding toddlers, preventing picky eating. Our objectives today, I'm going to talk about what key nutrients the toddlers need, more about the what of feeding, and then how to prevent and becoming a short order cook. And we'll talk about the why of feeding and the how of feeding, which is just as important as the what. We'll get into tips to prevent picky eating from turning into a problem feeder. And how do you know if you have a problem feeder versus a picky eater? So first, just a little bit about me. I'm a registered dietitian. I've been a dietitian for going on 21 years. I spent 8 years at Legacy Emmanuel Children's Hospital, pediatric, clinical, outpatient, and inpatient, and then had time in the feeding clinic there. I spent 9 years working in allergy treatment and prevention industry with Nestle and Nutricia. And I'm in the third year of my private practice, Portland Pediatric and Family Nutrition. I have offices in Portland and Vancouver, Washington. And my most important job is I'm a mom of two young girls, age 4 and 9, and I enjoy spending my free time with them. And my personal time, I enjoy snowboarding and road biking, hiking, and I do a lot of baking with my cooking too. So toddlers, what key nutrients are important at 1 to 3 years? And no matter how much time I spend on lining up the slide, it seems like whenever I transfer it to Click Meeting, everything gets out of alignment. So my apologies here, but I have calcium as in 700 milligrams, and we'll have another slide next talking about the kind of food groups to get these nutrients in. But children's calcium just continues to go up, and just an example, one glass of whole milk has about 300 milligrams of calcium. So that's 700 milligrams a child can get like with 2 or 3 servings of dairy. Then there's vitamin D, and here in Oregon we don't really get enough from the sun, so that's important to include with food. Iron and iron needs continue to go up. The vitamin E, potassium, zinc, and DHA, and just overall what they need is just a good balance in the macronutrients, the proteins, the fats, and the carbohydrates. So where do we get these key nutrients? The dairy group is an excellent source of the calcium and vitamin D. So as I mentioned before, 2 to 3 servings a day is a great way to make sure your child is getting and certainly getting vitamin D in those foods too. In whole grains, that your child's going to be getting your iron and zinc. Iron fortified cereals, breakfast cereals. Often there's iron and zinc in those foods. Fruits, excellent source of potassium, vitamin C, iron, and antioxidants. I only just named a few here, but there really isn't a bad fruit to include. Most fruit has a lot of great nutrients. And vitamin C helps increase the absorption of iron when a child is not getting iron from meat. So vitamin C is really important. The toddlers vegetable group, just keep introducing it. Now's the great time. I know all your toddlers are not necessarily going to be eating all these vegetables, but great sources of iron, vitamin C, antioxidants. Proteins, they can get proteins, chicken, fish, tofu, beans, eggs, and those foods are a great source of iron, zinc, vitamin D, and DHA, and the essential fatty acids such as avocado, seeds, nuts, olive oil, great source of vitamin and zinc. And there is research to show it does truly take 10 to 15 exposures for your child to accept a new food. So if you're looking at this and thinking my child would never eat that, then keep exposing it, introducing it, and making it fun. And there are some foods that just to try to limit at this young toddler stage, especially when you have a 2-year-old, 2 years and younger. Getting too much of these foods can displace really important nutrients for those really young children. So think about how much sugar your toddlers are getting. The guidelines are 10% of less of calories. So certainly your toddlers don't need any soda. They'll get a little added sugar from other foods like granola bars, but they really don't need desserts on a regular basis, and especially when they're 2 and younger, because it just displaces really important nutrients that toddlers do need. Refined and processed carbohydrates, such as chips, crackers, and just the snack food, and just limiting it because it's displacing important nutrients. Limit the high sodium foods, since young children do not need that much sodium, and get such as olives and the canned processed foods, pickles, bacon, pretzels, nuts, just the salty nuts. And then there's preservatives like sodium benzoate and food dyes that are linked to hyperactivity behavior. So I always encourage families to limit those. And the American Academy of Pediatrics does recommend limiting juice to 4 ounces for children 1 year and older. The American Academy of Pediatrics recommends no juice for children younger than 1 year. And that's mainly because the nutrients from fruit is going to be a lot in the actual fruit itself, and the fiber, and a lot of those key nutrients from eating real fruit. So what about the how of feeding? So I'm going to jump into here a little bit more about your role as a parent and feeding your toddler that can really affect their relationship with food. And I like to start with this picture, and this is a picture I pulled from the book Born to Eat by Leslie Schilling, a great book on feeding children, and it's showing that division of responsibility. And Ellen Satter is a dietitian and therapist who coined this term, division of responsibility. And this means that it's up to the parents to decide the what, when, and where. What are we eating? Where are we going to eat? On the counter or the dining room table, and when. It's dinner time or snack time. So the parents are the one who enforces the schedule, sets the schedule, and determines about the foods the child is being offered. And it's up to the child to decide how much and if they're going to eat, of what foods they're being offered. So it's up to the parent to provide the foods to the child, and up the child to, if they eat only one of the many foods offered to them, to decide how much and of what. Because children are born to be intuitive eaters. As a baby is born to cry when they're hungry and to turn their head when they're full. So children at a young age do know how much they need to eat. So feeding toddlers, so more like that, about that relationship behind that feeding of children. It's really important to have structure with meals and snacks, and this just lets the child know what to expect, and spacing meals apart, and knowing that the next snack, well, there's going to be lunchtime, and then there's going to be a snack about 2 hours later. And so children learn more about coming to the meal hungry and knowing to eat until they're satisfied, because they're not going to be grazing all day long, because that grazing takes away the appetite. So close the kitchen after meal or snack, preventing that grazing all day long. Eat with your children as much as possible. I strongly recommend family meals, and because children need to have positive role models. They need to know you're eating what they're eating, and this is how they're going to get introduced to new foods. And the research does show that family meals, that children who have more family meals are more likely to eat more fruits and vegetables, especially hopefully these foods are being served at the table. So always serve something they like with something new. So it's just kind of that exposure. I wouldn't expect them to try a new food like on the very first time, but always have something at the table you do know that they like, so you don't need to worry about them leaving hungry. You can give them choices at snack time. It's like, do you want the pretzels and hummus, or do you want the graham cracker and peanut butter? So it's more of a choice rather than just opening up the cabinet and saying, what do you want? Allow them to eat as much as they want of the food offered. So once you provide it to them, let them self-regulate their hunger, and know how hungry they are, and eat until they're satisfied. And cook with your children. Have them help you in the kitchen. I just wrote a blog post about this, and I will send it out with the replay, a link to this. So cooking is just such a wonderful way to get exposure with your kids in the kitchen, and even young kids, toddlers. They can get involved with washing fruits and vegetables, breaking up lettuce. So there's certainly many small tasks that can get that exposure for them. And if you have a child that doesn't like certain things and is saying yuck or throwing food, then consider a no thank you bowl at the table, so they know if there's something they don't want on their plate, they can put it in a no thank you bowl. And remember, and think about how you just serve dessert. Dessert should not be a reward for eating food, and children should not be rewarded with dessert. And that just sets up that wrong expectation. And they don't have to clean their plate if they're not hungry. So keeping mealtime pleasant and fun, and this is really about keeping the anxiety down in young kids. So you're not going to pressure your child to eat. You're not forcing them to sit at the table and clean the plate, because this just causes anxiety, and anxiety leads to a loss of appetite with children when they're feeling anxious. Don't bribe or reward at mealtime. Don't punish for not eating, and positive food talk as much as you can. I'm going to get into what positive food talk is. So talking about food as fuel rather than eat your good food versus your bad food. I don't like to label food for kids. I mean, even carrots can be bad if that's all one eats. So in my mind, all foods there's a place for everything, and there's not a good food and bad food. So when you discuss food with kids, think about, I like to use it as your growing food, or this is more like your brain fuel food. We're going to work on, focus on your brain food. My 4-year-old likes to call it her energy food. And is this good energy food? And everything's good energy food most of the time for her. And so for some foods like sweets, and that you can refer to them as like they're not going to be lasting energy food. They're not going to stick with you. They're not going to help you play hard at the playground today until you have your energy foods or your growing foods. We're talking about your body needs fuel each day, just like a car needs gas. And when you're describing eggs, like these eggs help fuel my muscles, which help me strong. Even talking about your own body and relating it to theirs. And if they say, I just want to eat cookies for dinner, and you say, yes, I know you prefer cookies at every meal. Cookies are fun foods, and we enjoy occasionally. And it's important to fuel our bodies with foods that provide lasting energy, fruits and bread, and so what other foods you're eating. So just the way we talk about food could help kids develop a healthy relationship around it. And I always like to ask the question, if they're full, is what does your tummy say? Is it still hungry? Especially if dinner time's over and they tend to say they're hungry within a half an hour of leaving the dinner meal. It's good to check in with them. Is your tummy still hungry? Or if it is, the kitchen's closed, and if it's still hungry, you should make sure you have fed it. And when you're serving a new food, you can talk to it, about like such as a kiwi. It's sweet. It's like a strawberry, and that's a positive food talk rather than this kiwi is a fruit and it's good for you, has fiber in it, but more of a describing it something maybe they've known before. And it's totally okay for children to have preferences. And when you're describing the broccoli is roasted tonight with olive oil, and you prefer it this way, or would you rather have it raw, dipped in your ranch, and getting their preferences, so next time, and you'll offer it differently. Or even describing this chicken taco. It's growing food, help you grow up, be as tall as daddy. So thinking about positive ways you can present food, and but you don't need to talk about it the whole way through dinner, And if my kids come to the table and they say yuck, my favorite words are, "You don't have to eat it," and I'll just smile and enjoy my meal. Um, so just realize keep dinner light and positive. So how do you know if you've been doing all these things we've been talking about, and you feel like your child is just eating less and less? Well, this is how I compare, like if there's a problem feeder, or maybe I'll put them in the category of a selective eater, um, then they're eating less than 20 foods a day. So if they're picky, then maybe they have maybe around 30 foods. But if they're a problem feeder, then that list is dwindling, getting less and less. And maybe you can count how many foods exactly that they're eating. And maybe they go on food jags, and if they're picky, they sometimes will eat one food for a while, and then they don't want to eat it for a while, but then maybe they'll try it again later. But if they're problem feeder, that list of foods that they have accepted gets smaller and smaller, and they start eliminating foods they once ate. If your child comes to the table screaming or anxious, upset, especially if foods are touching each other or there's a new food put on their plate. If just being at a table around foods causes a lot of anxiety, then that's something to talk to your doctor about. It's going to be more of a concern that there's a problem feeder versus just a picky eater. The problem feeder will not try new food after that 10 exposures, but you could be offering and cooking with your child and doing all these new exposures, and your picky eater will more likely eventually start adding more foods, but problem feeders don't. And picky eater will eat at least one item from each food groups, and I can usually look at their diets and say, okay, well, it's fairly rounded. You got at least one or two items from each food group. But problem feeder, I often see there's certain textures that are being avoided, or just certain food groups altogether. A lot of times I'll maybe call it the white food diet, because they may just eat only like rice and crackers and milk, and it's just certain colors. And the other thing I forgot to put on this list is if there's concern about growth. In addition to all these things under problem feeder, then I would be really want to have them evaluated for sure. A picky eater, most of the time, they're still growing, and the doctor's not concerned because they're still following a good growth curve. But you may see some growth. Not always, not always. It's amazing what kids' bodies can do and continue to grow. And so things to consider: all toddlers go through a stage of wanting to assert control. Eating is just one area a toddler will learn they have that control. Food may be accepted one day and rejected the next, and this is normal. How we respond to this behavior will impact your feeding relationship with your child and make it better or worse. And this is why I really want to strongly, tell all parents out there that the more relaxed you can be about it and keeping eating environment fun, then you're on the right track. But if you picked up a few things there, that your child is eating 20 foods or less, and their picky behavior shows no improvement, or you're observing some sensory or oral motor delays, I highly recommend having them evaluated. I added a pediatric occupational therapist, and we do a joint feeding kind of therapy visit for children 3 and younger, and so that could be an option if you have those concerns your child is a problem feeder. Definitely talk to your doctor and have them evaluated by a specialist. And there's certainly growing evidence that picky eating has a genetic factor, so you can blame yourself if you were and still are a picky eater. And I often meet parents who themselves say they eat a very limited diet too, and so it's hard for your child to get exposed to a lot of new foods when they're not seeing you eating those. So certainly happy to answer any questions. We have them. And I'm going to look at my chat box and yes, I'm going to be sending out a copy of a replay of this webinar for those who were late or missed it, to have the information. And I'm going to send out some of the links that may be helpful for those who have picky eaters, such as getting your kid involved in the kitchen and tips on and making that happen. And so if you have any questions, feel free to type them in the chat box, and if just stay on a few more minutes and answer those. But thanks for joining me today, for those who did, and hopefully those who are watching this later on the replay. Thanks for watching it. I appear to have some chatting, so I'm going to stay on. Oh, thank you, Carrie. Stephanie's asking, do you ever recommend hiding food in toddlers' meals so they eat it? For example, hiding some spinach in a quesadilla so he gets his veggies. Well, I don't really recommend hiding. I do some work like this I call more like food chaining, and using familiar foods to branch in and bring new foods. I mean, the younger the child, the easier it is just to kind of, like, if they're a big fan of macaroni and cheese, then you can um, blend up cauliflower and real small tiny chunks and blend it in with the mac and cheese. And so certainly that's, I would call that more like a food chaining of bringing something in. At least my daughter, I can't get away with putting spinach in her quesadilla without her pulling it out and saying yuck. But I like to be honest with kids and not necessarily hide things in there. I think a good way to, like, sneak in, but not necessarily like even making muffins out of like carrot and zucchini, and having kids involved with making them that way. It's that they, still getting the taste in there that they like, and they're seeing vegetables in a different way, that they could be presented, that is not just cooked in there. The tough thing about vegetables is kids have 3 times as many taste buds as we do as adults, and they're going to taste more bitter for them, and so it's not surprising that kids don't like love vegetables. But the more we can do to give them, like ranch dip or hummus, or ways that they can have fun with vegetables that make them more enjoyable, then that is a win-win, rather than trying to hide them in foods, because we're really not hiding them, and we don't want them to lose their trust in what they're really eating. Nothing wrong with trying a new recipe, such as I'll blend kale into my pesto once in a while, and it's there. It's just a different recipe I'm trying. And kids are welcome to be helping me in the kitchen with that. So certainly being creative with adding vegetables, I encourage trying it different ways. Emily is asking me about the MRT test. Stephanie, you are welcome. You know what? I'm happy, to talk with you about that. If you want to set up a free 20-minute phone call with me. I normally don't do the tests on kids younger than 1 year. I know some of my colleagues have. There's other routes I would go before doing food sensitivity testing. But I will probably have a food sensitivity webinar next month to dive into that. But you're welcome to set up a call with me to talk more about that if you have concerns, because that's okay, great. Will do. Okay, super. Well, thank you, ladies, for your questions, and thanks for viewing. And I'll be sending out the copy later today. Welcome. Say bye-bye.